Hi, I'm Mika Chalcombe, home ventilation nurse here at Sheffield Children's Hospital. Today we're going to be looking at a dry circuit for tracheostomy ventilated child. Both this and the wet circuit are replaced every week. You must make sure it comes in a clean, sterile packet. If the packet is opened, then you shouldn't be using the circuit if you have any other choice, because it may be contaminated. Please make sure you wash your hands before you open your clean, sterile packet, because if the packet has been opened, the circuit may be contaminated. And this is for tracheovented children who've got no ability to filter their own airway. When you open your tracheostomy circuit, you'll have a catheter mount, you'll have something called a HME, a heat moisture exchange, and you may have a separate exhalation port. You may have a catheter mount that has a right angle port at the top of the catheter mount for which your child breathes out. You must make sure somewhere in the circuit there's a space for the child to breathe out. Your tube comes with a viral filter already attached. You then attach a HME above where the child will breathe out, and you then attach the catheter mount. So now I can attach my circuit to my ventilator, my catheter mount to my child, and if I turn my ventilator on, the air would escape through the exhalation valve. The only part of the circuit I replace every 24 hours is the heat moisture exchange. That's because it's going to maintain any moisture that the child breathes out, so if they have any infection, bacteria will breed. The rest of the circuit is changed once a week, same as your wet circuit. If you have a child that requires oxygen through their ventilator circuit, they may have a ventilator that has an oxygen port at the back. Alternatively, they may have an oxygen port that you need to add into the circuit. These always come in your wet circuit attached to the humidifier. In your dry circuit, you will need to add it in. Some children choose to have them nearer the viral filter. If I have not got oxygen being administered, I must make sure the cap is on. If I am administering oxygen, I would remove my cap and attach my oxygen tubing. Other children who don't require oxygen all the time but may just need a blast of intermittent oxygen, such as when they have some sort of seizure, may need to have the oxygen nearer to them. This is often attached to the HME in between the exhalation valve. Again, remove the cap if you want to put your oxygen tubing on. Ensure that if you remove the oxygen tubing, the cap is returned. You should not be using more than 5 litres through the front of the ventilator circuit. That is the same for any type of ventilator, because the flow will change the pressure the ventilator is delivering. If you need to administer a nebulizer, this can be done through any ventilator circuit, but you must be very careful when doing it through a dry circuit. You must first remove the HME and then put in your nebulizer port. If you leave your HME in the circuit, any medication that is escaping through your nebulizer will saturate your HME and create a block so that no flow can get past it, meaning the child can't get any ventilation pressure. You then, as soon as your nebulizer has finished, remove the nebulizer pot from the circuit and reinsert your HME. If you have a child that has narrower tubing, the 15mm tubing, your oxygen port will be narrower to fit with it. Again, it's front of circuit, so maximum 5 litres. If you have a child that has an astral or a trilogy, they will have a white plastic port in their bag. If they're a child that doesn't always have oxygen, if they have always got oxygen, it will already be inserted in the ventilator. At the rear is a small metal port. You push up the metal port and just push the oxygen port in. You should be able to gently move it and it should not fall out. Because this oxygen is going through the rear of the ventilator where the air comes in, you can put 15 litres through. That's both for an astral or a trilogy. A NIPI does not have any oxygen port attached to the ventilator. It is all done through the circuits. If you have any further questions, please feel free to contact myself, Mika Chalcombe, or my colleague Lee Richardson at Sheffield Children's Hospital on 0114 27 17 000. Thank you.